Doctor, we were talking, of course, about that back pain, and I want to be more specific in terms of something that's very common, herniated discs. I know you're standing next to the biodigital human. Can you walk us through this and tell us what happens to, I think that's a healthy spine, and then what occurs after?
Absolutely, Yoga. So first, starting with the spine, I want to demonstrate where are the discs. So these are the bones of your spine. In between every level, you have a disc. What I like to tell my patients is imagine the disc is like a jelly donut. The center of your disc is soft and has a water component. The outer portion of it is made up of fibers. As you'll see in the next slide, the herniated disc a herniated disc is when that jelly donut has compromised the outer edges. You've actually squeezed that jelly donut, and now some of that jelly has come out. That's painful, and depending on where that jelly goes is where you'll experience that pain.
So let's see if we can get that herniated disc, and I believe it's quite common it is in our population today, more than ever, regardless of age for that matter.
Absolutely. Multiple reasons. In terms of young athletes and kids are more active nowadays than they were in the past. And we have more sedentary lifestyles. So many people are just sitting behind a desk all day at work. Slouching and poor posture, sitting at a desk, predisposes you or puts the disc under unnatural pressure. So this just predisposes you to herniate that disc. So here's the disc. Here's the jelly. Imagine this is a donut. This is your jelly. This is your fiber. Abnormal pressures will cause some of this jelly-like substance called the nucleus pulposus to come out, to actually breach that outer fiber. The most common place for that is to the back and to the side, and we have a nerve that lives there. So if this jelly touches your nerve, you're gonna get this pain going down your leg. The jelly can also come to the center. That might cause just back pain. Sometimes the jelly comes and just hangs out in the back portion of the disc. So you may have a herniated disc, but you may not have the leg symptoms. This is so common. I see this every single day in practice. And whether you're healthy and in shape or sedentary or have a physical job, I mean, it really happens to anybody. There's things we can do to try to prevent it, but even still, it just happens all the time.